Selam, hoş geldiniz. Welcome to my channel. My name is Kaylee. I'm an American living in Turkiye, and I would love to tell you about the Turkish healthcare system. In this video, I am giving my honest review on the free healthcare system in Turkey, the pros and the cons of it, and the different ways you can access it as someone who is living in Turkiye. Throughout the examples I'm going to give you, I'm also going to share with you different stories of literal things that I've gone through by going to these different hospital institutions. So, strap in for this video, hit that subscribe button if you are interested in content about Turkish culture from an American lens, or about the life of a foreigner and how to thrive when you go through the roller coaster ride of being a foreigner. There are three types of medical care institutions in Turkey. There's public hospitals, private hospitals, and university hospitals. Now, there are private practices and clinics within that, but they're a smaller thing and they're not something that I've interacted with nearly as much. So I am speaking from experience and stories in this video, okay? And I'm sure people on the other end, the doctors, would have other opinions. So if so, I invite you to share your opinion in the comments down below. Let's break down these three different structures. Public hospitals are completely subsidized by the government. I have been to the public hospitals multiple times, and I can't recall ever having to pay anything upon leaving. Private institutions are not subsidized by the government, I don't think at all. There are insurances that will be accepted at different private institutions. However, it's a lot more like the American system where different hospitals are in network for different private health insurances. Now, health insurance in Turkey is not nearly as expensive as it is in the United States, and private hospitals are not nearly as expensive as healthcare in the United States. Even so though, it's a big jump to go from everything being for cost and everything being free. So the private hospitals and the public hospitals are very different. University hospitals are this magical place right in the middle where it's an educational institution, therefore they have access to more equipment, and they are partially subsidized by the government. I have been to all three of these institutions, and I'm going to tell you the pros and the cons of each one. Let's talk about the public hospitals. For me, the public hospitals have the biggest list of cons. Here are the pros of the public hospitals. They are free. You can get into a doctor, you can get medication, you can get exams, you can get tests for free. That is that. But here are the cons. Public hospitals here, and I've been to multiple of them, are crowded. They are so crowded. Not only are they crowded, but they are also dirty, okay? And I'm sorry to hurt anybody's feelings by just being so blunt about that, but they are dirty. One time in the middle of the night, I woke up really sick, and my husband said, let's go to the doctor. I wouldn't have gone to the doctor because I'm an American, and we just don't do that because of the healthcare costs. But we went to the doctor, they got us in, they wanted to give me an IV to help the pain and such. I just had a stomach flu, like I was fine. But they wanted to give me an IV. We go to the place where they're gonna give me the IV, where the different beds are laying down in the room, and the paper on the bedding is dirty, like dirty. And I looked, and nurses were just sitting down on their phones. My husband changed the paper for me. So that really shocks me. This isn't a culture shock video, but that's a huge con for me. The fact that the hospitals are so dirty. And I understand in the chaos of the day when everything is going on, it's hard to keep everything as clean as it should be, but it's a hospital. I have never encountered in my life dirty toilets the way that I do in public hospitals in Turkey. Absolutely foul and disgusting. They are dirty. Another time I went to a gynecologist at a public hospital, and they had me change out of my clothes in a booth that was so small, I could not help but my rear end touched the wall in trying to remove my pants, and there was a stack of dirty cloths and dirty papers in the booth. I'm talking women had wiped their bodies before me, and it's stacked in the booth. So this is the biggest con for me. It's dirty. It's dirty and it's crowded, it's chaotic. The doctors are very aggressive, they can be very rude. Whew. It is an ordeal to have to deal with the public hospitals. Now, I know that might come off as really insensitive in some ways, or I'm sorry if anybody is offended by me saying these things, but it is true. It's really true. And maybe not every single public hospital is like that, but I've been to 3 or 4 different public hospitals and they are the same. I understand that there is an economic crisis, I understand that there's a funding problem, I understand all of these things. That doesn't make the reality of a dirty medical center being a good thing. It just means there's multiple problems. Let's move on to private hospitals. There are lots of private hospitals all over Turkey, and let's just hit the pros. They're clean, they're fast, they're friendlier, they're thorough, they have access to good equipment, so sometimes just the atmosphere of a private hospital is what you're wanting to pay for, because you could get an IV for dehydration at a public hospital, or you could get an IV for dehydration at a private hospital. And if that cost doesn't mean too much to you, then great. Now here are the cons of private hospitals. They are for profit, right? They're trying to make money. So when there are scams about hospitals, they're coming from private hospitals. I've seen some things on the news where doctors have gotten in a lot of trouble for malpractice, and it was because they were making money off of their patients. Something that I can't say I've directly witnessed or directly experienced, I've just heard it through the grapevine, is that they kind of target that medical tourism. They are a business, they are for profit. Are they gonna do a good job and get it done? Yes. Are they gonna try to charge you as much as they can? Yes. However, I think in Turkey, they aren't allowed to just charge the most extreme prices for things. There's a regulation of price for different services. So I don't think that even for private hospitals, it really gets that expensive. Now, I'm speaking to Western currency. It is not the same thing to say that something is not expensive for a Turkish citizen and not expensive for a UK citizen. These are different currency values. Private hospitals are very expensive for local people because the economic crisis that's happening here and the loss of buying power of the lira. I know a lot of Westerners prefer private, and I know a lot of Americans here who will just pay for everything out of pocket private here, because it's cheaper to pay for everything out of pocket than it is to have insurance in the United States. I think that as a Westerner living here, you have to have insurance though. So I'm not really sure how that happens, and a lot of Americans I know who live here are teachers and English teachers, so they do have insurance through their schools, but they still prefer to go to the private hospitals, which is fair. I get it sometimes. But now let's move on to university hospitals. University hospitals are like the beautiful middle ground. They are cleaner, but they can still have pretty dirty bathrooms. I've literally never been in such horrible public bathrooms as I have been in government subsidized hospitals in Turkey. They are insane. So clean doctor's offices and clean hallways, really dirty bathrooms. And when I say dirty bathrooms, I mean like the toilet seat is missing from the bowl. And there's no toilet paper and there's no soap. They are less crowded, but you can still wait a long time. You're still gonna pay for exams like MRIs and ultrasounds and other types of things, but you're not going to pay for all of the appointments and such. So some things you pay for and some things you don't. Another pro is that a lot of the doctors are also professors and they speak English. And because it's educational, they slow down a little bit more and they're more thorough with the care. Another pro is that they have more equipment. Because it's an educational environment, they have access to more equipment in case of different emergencies and such. Now, one of the cons of the university hospitals is it can be challenging to get an appointment. You can spend a lot of time there trying to figure out which doctor you need to meet with, which doctor to go to, and get an appointment and such and such. So that can be a little bit challenging. Of the 3 options, private, public, and university, I actually prefer the university hospitals because I feel that they are genuinely interested in my care. They are not trying to get any extra money out of me. They've been very thorough, they've really taken good care of me, and they're decently clean, and I just bring my own toilet paper to the hospitals for when I need to use the bathroom. Private hospitals are nice, it's just not an expense that I've been ready to pay yet for certain things, and public hospitals have been my own personal nightmare that I absolutely hate and I don't ever want to go back to, especially for women's care. And I've actually had a lot of female Turkish friends tell me that they never go to a public hospital for women's care because they are just not kind, not gentle, and it's not clean enough. And this is crazy. You wouldn't expect that. So I'm sharing this in this video because it's honest, it's true, it's real, and it's not just my experience, but I'm speaking from my experience. And I can imagine that it would maybe hurt someone's feelings for me to say, hey, the hospitals in your country are dirty. I'm sorry. But we can say lots of terrible things about my country and I can be upset about it and it can still be true. So Okay, like I said, there are private clinics and private practices here. They're not something I've really engaged with, so I can't really speak to those things. But what I would love to say is that free healthcare is not free. It does have a cost. We do pay for it somewhere in our lives, somewhere in the system with the taxes. But what I can say as an American citizen who has actually had medical debt at young ages and has experienced the fear of going to the doctor because I don't know what the cost is going to be, there is a give and take here, but I consider it worth it, that I can go to the doctor in emergency cases and I can go to the doctor without fear of it destroying my financial security. I have been so grateful and so blessed by this healthcare system. We have learned of different cancers that are in my family, and I was able to go to a public hospital and do completely for free genetic testing for these particular cancers and learned that I don't have the gene. I don't know how I would do that in the States because I didn't even know how to have the right kind of insurance in the States when I was younger. I graduated, was working in my career, they didn't offer insurance yet at the positions I had, and then COVID came and I literally didn't know what to do, and the market prices of insurance was insane. So yes, I could do Medicaid and such, but we know that that doesn't mean free. We know that that doesn't even really mean affordable and accessible. So I was able to access healthcare here, even in hospitals that aren't of the better quality that I would prefer to be in, you know what I'm saying? Based on everything I just said. I was still able to access healthcare here in these conditions that was more accessible to me than the healthcare in my home country, the United States. My honest review of Turkish healthcare is that it is trying its hardest and it is definitely under a lot of pressure. I've learned that a lot of doctors have left the country in the last decade or so. I know that the system is very overcrowded, overclogged, and I don't understand the dirty bathrooms in the hospitals. It'll just never make sense to me because the one place you need to have as much sanitation as possible is a hospital. But at the same time, I have been to clinics in the United States that have a snack bar. Why is there a snack bar but not affordable healthcare? So I am so grateful for the Turkish healthcare system, and I know it's not perfect, but it is functional and it's doing something. So I'm just really appreciative of that. And I wanted to make this video to share this with you. And I really breezed through this video because actually I'm in a lot of pain. I'm gonna show you something. This is my neck brace. It is goes on like this, wraps around. I injured myself and slipped a disc, my C7 vertebrae, slipped a disc in my neck, and it's been a really long recovery. This happened about 6.5 weeks ago, and I hid it very well, kept it under cover very well, but now that I'm toward the end of the healing journey, I'm finally like, oh guys, guess what I just went through? And I was so fortunate to be able to go to a university hospital where they ordered an MRI, and we paid like 1,300 lira for this MRI, which is around, at this point, I don't know, I'll put it on the screen because it changes all the time. But we paid 1,300 lira for the MRI. They were able to figure out the injury. In fact, I'll put it right up here on the screen. You can see where the line is going through that bump. Now I'll change it to show it without the line. Now here it is, so you see that bulge, that is fluid that came out of the slip disc and pushed on my nerve, and it hurt. It hurt a lot. It hurt a lot, and it really slowed me down. That injury inspired this video because regardless of all its flaws and the intense environments and such, the Turkish healthcare system has really served me really well. So I just want to express that gratitude. Also, we are at the end of our video. I would love to show you my new dress. Would you like to see it? Look! It's so cute. I think it's elegant, and I can imagine it with like a pair of Adidas, a little denim jacket or something, you know, hair up maybe. I don't know. I think it's super cute, and I'm super excited to make more content soon. I'm just in pain. So it's coming a little bit slow, but I have something amazing to announce in my next video, and I'm just so grateful that you guys are here. So please drop a comment down below if you enjoyed this video, or let me know anything I need to know about the healthcare. Let me know anything I need to know about the healthcare system that I don't know yet, because I am a foreigner navigating this. And thank you so much for all the warm, friendly, beautiful comments. And I love you guys. I'll talk to you later. I gotta go. Awesome. Okay, bye.